Hello everybody, this is Dr. Steve Bordazavi. We're at Valley Pain Specialists in Bethlehem, Pennsylvania today. And today we have a patient who's been a long-time patient. How long, Thomas? About 16 years?
Yes, maybe a little longer.
Maybe a little longer. And there's thank you for agreeing to be in a video here. Thomas is a very good guy. He's a patient that's having a procedure today called lumbar medial branch block. And essentially this procedure involves diagnostically trying to determine the cause of the patient's back pain. If you can zoom in a little bit to the spine model here in the back, is it the right or left side today, Tom?
Today's the left side.
So the left side will be over here. And what we're going to do is place needles, if you can direct your attention right here to this dot here, this dot here, and this dot here, and this dot here. We're going to place some anesthetic right next to these little bones here, on which, not shown on this model, is a small nerve at each location which supplies the sensation to the joints. We call these facet joints, and we can zoom out of there. They're called facet joints, and basically what they do is they supply sensation to the joints which allow patients to bend backward, forward, and rotation. Same joints that chiropractors might crack and adjust when you go to a chiropractor's office. And as we get older, sorry Tom, but as we get older, people do start to develop some arthritic pain in the back from these facet joints, and we call that spondylosis. So in order to prove that as the diagnosis, which he'll be the judge of, we're going to numb up these joints today, and he's going to go home and do his normal activity, and not just sit around, but determine whether temporarily blocking these joints makes a difference in the pain. We would want to see at least about 80% improvement, not forever, but at least temporary 80 to 100% improvement on this side that we do. And then if it does seem to help him, we'll bring him back at a later date for a more definitive permanent procedure, which we can actually burn the nerves, which is called radio frequency ablation, RFA, or radio frequency denervation, which is also shown on some of our other videos that we have on our YouTube channel, which you're free to take a look at. So if you like us, go ahead and give us a thumbs up, like our channel, and I hope you enjoy the rest of what you see here today. Okay, so what we've done is we've placed the C-arm in what we call a Scotty dog view, which is about a 30-degree oblique, in this case towards me because we're doing the left side, to visualize the spine. And if I can direct your attention to the monitor, you'll be able to see over here what may or may not look to you or the audience as a Scottish Terrier. It's a little bit hard to see, but this is the ear of the dog. Here's its nose coming out. The eye will be right here. Again, the ear, nose coming out, eye will be right here. The joint itself is this white line here, which is somewhat hard to see, and the reason it's hard to see is because he has arthritis. And so if he was younger and didn't have that, it would be much easier to see. But the view that we use for this procedure, and if I can direct your attention to the monitor, is the Scotty dog view, which the target for this nerve would be right here. The target for this nerve would be right here. For this nerve would be right here. And we're going to numb up about 3 or 4, in fact, in this case, 4 of these nerves, which supply sensation to the 3 lowest joints on the back on the left side, the facet joints. So that's the approach and the fluoroscopic angle that we take for this procedure. All right. She'll lower the table down. I'll gently administer about 1 ml or so of anesthetic at each of the nerves to try to numb them up. Very precise. You don't want to give too much so that you get a false positive result. And that's it. We pretty much have numbed up all 4 of those areas. And that's the end of the treatment. It's pretty quick, easy treatment, right, Tom? Not too bad?
Absolutely no.
Didn't hurt you, right?
Nothing at all.
This guy's tough. This guy eats nails for breakfast, okay, without any milk. That's how tough he is.
I think he's stretching a little bit.
So he'll keep track of his pain for the next 48 hours. We'll give him a piece of paper. The technician will put some Band-Aids on. He'll be going home in 2 minutes. And I want to thank everybody for their attention, and I hope you enjoyed the video. So go ahead. So we're in the recovery room 2 minutes later here. So far, so good, right? The pain seems better.
Wonderful.
Try to keep the patient satisfied. Try to get him some relief. And like I said, right now, you've already noticed the difference. You've already started to notice a little less pain on that left side. And hopefully you get a few days out of this, and then we can come back in at a later date and deaden those nerves, radio frequency ablation or denervation, and give you some longer relief, which can be a year or 2 or more.
Wonderful.
Thank you, Tom.
I'm looking forward to it.
Appreciate
Thank
it
you,
so
Doctor.
much. Appreciate it so much.
Thank you very much.
Thank you so much.